Alaikum, everyone. May peace be upon you. This is Edward Ahmed Mitchell, Deputy Director of CARE National. Welcome to the Daily Dose COVID Conversations with CARE. Today is May 21st, 2020. We are on the 28th day of Ramadan. Inshallah, tonight is the 29th. We're so happy that you've joined us today. We're here today with our wonderful co-host, Zainab Chowdhury. Assalamu alaikum, Zainab. How are you?
Wa alaikum assalam, alhamdulillah. How are you doing, Edward?
I'm doing well, alhamdulillah. And as you all know, Zainab is the director of our Maryland Outreach Office. So before we begin, of course, we begin with the name of Allah. Bismillah ar-Rahman ar-Rahim. Alhamdulillahi Rabbil Alameen. Wassalatu wassalam ala Sayyidina Muhammad wa ala alihi wa sahbihi ajma'in. So today we have a really interesting program. We're going to be talking about, with an expert from the CDC about some of the critical issues facing America, the world at large, related to COVID-19, get a lay of the land of where we stand now. It's been 2 months that we've been dealing with this pandemic. Where do things stand now? What can this Muslim official with the CDC speak to us about today and share with us in his private capacity, inshallah. Zainab, please introduce our guest to the viewers.
Thank you so much. It's great to be here and welcome to all of our viewers. We're so excited to have you here with us as part of today's Daily Dose episode. And obviously, as we wind down the month of Ramadan, I pray that this month has been filled with blessings and khair for you and your loved ones, and that you've been able to benefit from every single minute of this blessed month, to make the most of it, to spiritually rejuvenate ourselves and reconnect ourselves with Allah subhanahu wa ta'ala, and really kind of immerse ourselves in the Quran. And as we wind down, normally at this time, we are preparing for Eid, generally preparing for Eid prayers in our masajid. And this year, obviously, Eid al-Fitr is going to be a little bit different because of the quarantine. And so in Maryland, we've been having a lot of conversations with mosque leaders in terms of, what can we do? What can we not do? I know like many cities across the country have started to phase into some level of reopening. Here in Maryland, I know many local districts have decided to continue with the lockdown, even though the state guidance has been to lift it to some degree. I think houses of worship are allowed to have up to 50 members in different, churches, mosques, and synagogues and temples. But many faith leaders have actually decided to abide by the local government's guidelines to continue with the lockdown, just because the numbers are not where we need them to be right now at this point. So today's conversation, I think, with our expert panelists will be really enlightening, especially as we head into this holiday, because even though there's a lot of gloom and doom in the world, we still want to be able to benefit from the sunnah of the Eid prayer and be able to celebrate with our families, inshallah. And so we're very excited to have today with us Dr. Isam Vaid, who is a health scientist. He is a health scientist in the Division for Health in Heart Disease and Stroke Prevention at the Center for Disease Control and Prevention, where he co-chairs a work group on the health of Muslim populations, a CDC science work group. He also serves as a Muslim religious life scholar and advisor in the Office of Spiritual and Religious Life at Emory University, where he earned his master's degree in public health in Atlanta, Georgia. He received his PhD in public health from the Riles School of Public Health at the University of Alabama at Birmingham, and he enjoys working at the intersection of public health and faith communities, which really ties into today's topic. We do want to insert a disclaimer here that Dr. Vaid is appearing on our Daily Dose show today in his personal capacity. So his views do not necessarily reflect the views of the CDC or the federal government. But even that being said, we do hope to delve into some of the critical kind of topics related to faith and science and public life and public health, and how do our communities prepare for Eid, inshallah. Welcome, Dr. Vaid.
Assalamu alaikum. Bismillahir Rahmanir Rahim. Thank you for welcoming me to the show today.
Alhamdulillah, it's a pleasure to see you, brother. It's been, we were just on a call together discussing COVID-19 with the Georgia Muslim community, and Dr. Vaid and I participated on a panel together. It was years ago on Islamophobia, and that was a great event. Great to work with you, and it's great to see you again. Alhamdulillah. So, Doctor, let's talk. And again, we've already noted that you are speaking today in your personal capacity, so we'll just emphasize that once more, inshallah, for the record. But we all know that this virus is still out there. It's still infecting new people every day. It's still a danger to society. But things are evolving, things are changing, and people are starting to open up. So the first question we want to ask you today is, what is the current state of the virus in America? Are things really getting better? Things staying the same? Just give us a lay of the land. Where do things stand right now? Because we're hearing conflicting things. Some states are saying things are getting better, and then we're hearing the results that they're using may not be accurate. Just what's a general lay of the land? Where do things stand right now?
So where we are at the moment, we also have to think about how big the land is, and each place is unique, and each place has its challenges. And with that being said, there are areas where we have seen some improvement. There are areas where there is worry about things, still increasing in terms of COVID infections and people getting ill and whatnot. So there is a lot of talk about opening up America again. And the White House has put out some guidelines about opening up America again. And there are particular criteria that are listed. So we are cautiously optimistic. And we have to take it a day at a time, a week at a time, and strategize.
And a locality at a time, it sounds like every locality, it sounds like you're
locality
saying.
and time, and pay attention to local and state authorities as well.
Absolutely. Thank you, Dr. Vaid. Go ahead, Zainab.
I think that point, Dr. Vaid, that you made, and you as well, Brother Edward, about the locality is so relevant because obviously from city to city, the reality is very different. Even within, for example, I'm based in Maryland, you're based in Georgia. And that is very interesting to see how that plays out. So Dr. Vaid, when we spoke earlier, we talked a little bit about the conflict between science and religion and how calamities have a way of bridging that divide and bringing communities together from different sectors of society. In your experience, can you expand a little bit on the two and talk about the interconnection between public health, faith communities, and religion, both in general terms and then more specifically as it pertains to the Muslim community?
Yes, it has been my privilege to be learning on the intersection of public health and faith communities for many years now. So public health and faith communities are an essential partnership. Faith communities being concerned with people, and public health being concerned with people. And one could argue that public health and faith communities in the context of the Islamic tradition goes back to the genesis of the Islamic tradition. Many of our scholars have shared with us that the Prophet, peace be upon him, said that if a plague breaks out in a region, do not go there. But if you are there, then do not come out of it. And it is a hadith that is attributed to our Prophet, peace be upon him. Or we can think about something as simple as wudu or ablution, which is purifying ourselves for prayer, but we also clean ourselves and we pray in congregations. And so we are cleaning ourselves as we go into congregations. So the questions we ask ourselves, the questions we can ask ourselves is, how do religious values inform public health approaches? And how can public health solutions be delivered through faith communities and institutions? So let's unpack this just a little bit. How do we design approaches and solutions based on public health? How do we design solutions to public health based on religious values? And so we'll cover both of those. So when we're talking about religious values, we're talking about connecting with the community at the grassroots level, doing it in a religiously and culturally appropriate way, so that at the end of the day, the community is a full partner in the process and can take ownership of that public health solution. So we're talking to the community, we're talking to the opinion leaders as well. So for example, let's take the value of cleanliness. And we know that the Prophet, peace be upon him, said, cleanliness is half of the faith. That is a hadith. And the Quran talks about Allah subhanahu wa ta'ala loves those who purify themselves. So those are religious values. And we take the value of cleanliness and we take the action of wudu. So let's imagine a place where there are a group of Muslims and they have a fresh water source and that's being used for wudu. However, that is not safe. So in that water could be Negularia fowleri, which is a tiny little amoeba, and it travels up the nose and lodges itself in the brain. And then it can lead to death because the brain swells up. And so how do we protect ourselves, and how do we design a public health solution? So based on these values and the need to do wudu for the community, we can boil the water. We filter it at 0.1 micron or smaller, and perhaps disinfect the water with the safe level of chlorine. And then we have designed a public health solution based on a religious value, supporting a religious action.
That's so fascinating. And not to cut you off, Dr. Vaid, that's so fascinating. And there's a bunch of questions that we want to get to, but it really reminds me of the fact that how when we talk about specifically in the Islamic context, how people always say there's a conflict between religion and science, how these hadiths can actually use to prove to be very beneficial when it comes to implementing some of these policies. Alhamdulillah.
So the second piece of it is something we have seen for decades. How do we implement public health solutions through faith-based organizations? So for example, compassion care for vulnerable groups. It's happening at mosques, it's happening at churches, and other places of worship. If we want to get the message out about, say, diabetes prevention and healthy nutrition and how to read food labels, we could do a class for our masjid community. And for example, we have a virulent disease and we uncover a vaccine. So people are gathered at the mosque, and that would be a good place to deliver immunizations. And that has happened quite a bit over time. We've seen that. And so with that, I wanted to present at least these two paradigms as part of a framework that we can look at public health and faith community and religion relationship through at least these two lenses. And I hope that helps set the framework for the conversation.
Yeah, that's definitely helped, Dr. Vaid. So let me ask you this. So in terms of COVID-19 in particular, this unique disease, its unique dangers, its unique impact on people across America, and in particular houses of worship, given the stories we're seeing about churches opening up and then people getting sick again very quickly. We've got some, people saying, we've got to open up sooner or later. How do we do it? How can we safely do it? So what do you think that partnership between the Muslim community and public health officials looks like in figuring out a way to open up safely? I noticed that in the new guidelines that came out, houses of worship are not mentioned anymore. So where there's no specific guidance for houses of worship, but I assume the partnership will still be happening at the state and local level and federal level. So what would you suggest in terms of how Muslim communities, when it is time to start opening up, can work with their local governments to do so in a safe way, to get guidance about what is a safe way to do it if they're not getting guidance from other sources?
Okay, so what we can think about, first of all, is how do we see ourselves in the Muslim community first as a partner in this relationship? So what we have seen so far in the 2 months is our shuyukh, our imams, our religious leaders, laying out the religious values for us based on precedent, and telling us that, the preservation of life is paramount. And the Holy Quran says that if you save one life, it is as if you have saved all of humanity. And our practices, of course, are Salatul Jummah, Friday prayers, classes at mosques, community gatherings at the masjid during the month of Ramadan. Then, of course, we've had activity with the mosque administrations as well. And they're talking about, okay, we're concerned about the health of the people. So can we open up safely? And when can we do that? And because there are concerns around it. These are matters of life and death and afterlife. And how long can we keep the mosques closed? And what impact will it have on our children if and they are kept away from mosques for a long time. And of course, public health and medicine is well represented in our community. And there is concern about the health of the public. So we have organized ourselves in conversation and communication. And with that said, we do have national bodies that are collaborating together to address this challenge of COVID-19. So there are guidelines for opening up America. www.whitehouse.gov/opening America, or if you go to www.cdc.gov slash
Dr. Vaid, I'm
coronavirus.
going to interject and push back just a little bit, because obviously, as we've seen with my colleague just mentioned that the White House has not officially given instructions or cooperated with the CDC to provide guidelines for house of worships in order for them to know like what the process is, how to phase in reopening for their specific institutions. In your capacity, I know that you're working with the National Muslim Task Force on COVID-19. In your capacity as your affiliation with them and the other national Muslim organizations, I know that there are some guidelines that have been established. Can you share specific content that might be helpful for mosque leaders who are watching this, or community members who are wondering, when can we get back to the mosque? Like, what should that process look like? What are some key factors that should be taken into consideration?
Okay. So the National Muslim Task Force has been keeping up with the guidelines that are out there. And so we do have, again, like I said, Opening America, again, guidelines, and then CDC activities and initiatives about opening up America. So those are the broad layer of, okay, we have to see a downward trajectory for 14 days in phase 1, and we can only have about 10 people, and vulnerable groups still need to stay in place. So those are some general frameworks that have been used. But let's talk about what the guidelines are. So if we open up mosques, the issues we encounter are things that we have to think about. And the task force has put out some great resources. First, a statement on opening up mosques, a joint statement, and also some nice infographics based guidelines. And some of those guidelines we'll get into, and task force has actually put out a checklist of things to check. And there are several categories in that checklist that the task force has put out. For example, mosque leaders talking about reopening strategy. And how do we open? What is the administrative plan? What are the roles and responsibilities of mosque staff and volunteers? And how do we maintain disinfection protocols? And what are the roles of community members? And so that task list is available.
Could you share the website or the link that could be visited?
So I was able to find it at imana.org /coronavirus. And it's right there. And right at the back of the joint statement is this checklist. So mosque leaders get together with their leadership and make those decisions based on the particular situations in those areas. And then we can talk about specific guidelines, such as, okay, if the mosque does open up and the situation is safe enough to open up, then leave the doors open so we don't transmit the infection through door handles.
So circulation is important.
Circulation is important. Bring our own prayer mat. Do not share these items. Mark spaces where we can stand 6 feet apart.
And Dr. Vaid, I'm sharing that checklist on the screen just so people can take a look at it.
Thanks for sharing that.
This is very helpful information. Yeah.
It's really very helpful information. And what about, a COVID-19 safety officer? So if people are coming into the masjid, we check their temperature, we ask them for symptoms. We send out guidance to keep the vulnerable populations at home, like older members of our family, like folks that have chronic diseases, folks that have immunocompromised systems. So we have to be very thoughtful. on how we can do that and keeping common areas closed, like wudu areas and restrooms, etc. So a lot of thought has to go into it, and each mosque has its leadership and perhaps a board on top of that. So those leaders have to get together and make those decisions and keep in mind local and state guidance, as well as the national guidance that is available.
This is incredibly useful information, Dr. Vaid. Thank you so much for sharing this. I mean, I know that we've got a call here locally in Maryland with mosque leaders, and I'm planning to share this link, this information with them, because I think this can be really beneficial when they come into not only, planning for Eid this weekend, inshallah, but more long-term, like what does it look like when they talk about restarting activities and things like that, inshallah. So thank you for sharing this.
Oh, my pleasure.
Yeah, Doctor, as we've got a little bit of time left, I want to ask you kind of the opposite question. So for those mosques or churches or synagogues who maybe start to open up soon, not that that's not necessarily a good idea, but if they're just going to do it anyway, what are some things they should not be doing? Like we know about some of the things you should do, appoint a safety person, but what are some things that, is just not a good idea to be doing, like some warning signs we can give people if they're going to open up in some capacity?
So let's not become overconfident. I think we have to have some humility. In science and medicine, we know a lot, but there's a lot we don't know. So one thing, for example, I have seen locally here in the greater Atlanta area, that there is some state level opening up, seeing a lot of people out there in public, in grocery stores, in parks, without masks, without gloves, and makes the mind wonder: are we going to be spreading infection? And are we really ready to do this? So perhaps we shouldn't be going out in large groups in public areas. Without these pieces. Also, we can think about something that is real dear to us, like Eid. And at Eid, we greet each other, we visit each other, we visit houses, we share food and things like that.
Mhm.
And we have to be thoughtful about that. For example, we've gone to the grocery store to buy some gifts for our friends on Eid, and then we visit their house. We might be taking the infection there, and they may have an elderly person there. And so we might become a conduit of transmitting. So all these little things we should think about not doing at this time. Yes.
And when it comes to Eid traditions that can be preserved, I know the Fiqh Council of North America has issued guidance for our communities, basically saying that it's advisable or it's permissible to pray at home, to kind of still fulfill the sunnah of the Eid in terms of dressing in nice clothes and greeting loved ones, abiding by social distancing rules. What traditions that relate to Eid that historically have been practiced would you say are still permissible under these conditions, like in this quarantine Eid that we're going to be observing, inshallah? So we know we should not be taking.
As you have mentioned, there's a lot of tradition that we have on Eid, starting with the ghusl, eating something before going to the prayer, wearing clothes, saying the takbirat, greeting community members, sharing gifts and greetings. And so one thing that comes to mind is that all these things we can preserve, and praying at home, as some of the fuqaha have recommended, we can do that. Things that are more challenging at this time is greeting each other like we traditionally greet each other, with Eid greetings and hugs and all those things. So we may want to think about alternate greetings without really connecting physically.
But no handshakes and no hugging.
Yes, maybe elbow greetings,
what about foot
maybe
shakes?
hand on the heart, something like that, and be really thoughtful about that.
Yeah, absolutely. I was saying it's been literally, and it's remarkable to believe it's been probably 2 months since I've shaken anyone's hand. It's crazy to think about the blend. It's a blessing you get. Muslim, you shake your fellow Muslim's hand, and you give them salams, the sins fall off, and this is something we missed out on. But maybe not. Maybe may Allah grant us the reward for what we would have done.
Intention counts for something, right?
Absolutely. Intention is the ball game. Okay, so doctor, as we wrap up here, it's 3:26, but we've got you here. We want to make sure that we get the benefit of your expertise. So what I'm showing now is what can be found on the website of imana.org. On the banner up top, and that's the Islamic Medical Association North America. At the banner up top, you'll see COVID-19. Click on that, and you'll see the statements they put out. This is about the second one down, and it shows you the advice that they are giving about the lockdown, what the benefits of it. One of the things they're pointing out here is the second wave of these sorts of pandemics, often more dangerous than the first wave. And one of the things you mentioned, doctors, right there, complacency, that people, just go out en masse and they just think, oh, it's okay, I can't take it anymore. And then we end up back in the same situation again, only worse. So we encourage everyone, take a look at this and look at these specific ideas, suggestions. Can you walk us to just maybe mention some of these things, doctor, that you're looking at just for people who, this is just individual suggestions for people.
Yeah, these are individual suggestions, and they also apply at a communal level. So we already talked about touching door handles, alternate greetings by not shaking hands, wearing cloth masks, because we still need the N95 mask for our medical personnel. And let's not forget to thank them. They're out on the front lines, the medical people, the nursing people, the healthcare system people, the public health people, my colleagues at CDC out on the field. And we are really, really grateful to them.
Yes.
Keeping at home, high-risk individuals, not visiting sick people at this time. And something very common, and many of us have probably gotten better about it, but washing our hands for 20 seconds. And let's do that thoroughly. It is really something that we have to ingrain in our habits really well. And of course, an extension of us are cell phones. So we have to wipe them clean, and our keys and all those common things as well. And so I know that most people will be praying Eid Salah at home. But there may be some folks that are thinking about praying at the masjid within the guidelines and taking the proper precautions. So if it's indoors, then outdoors is preferred if we're talking about 10 people or less and whatnot. So we still have to apply the 6 feet apart. We still have to wear the mask, still no handshaking. So it applies at the individual level, but it also applies at the community level.
Gotcha. Zainab, you want to ask a final question before we wrap up?
I do. Dr. Vaid, this is all such helpful and relevant information. And, a lot of people, I think, have been struggling to decide how we are going to observe this Eid and whether it's even worth observing. And I think the FYI put out a very helpful toolkit yesterday talking about how it's so important to build resilience through celebrating these milestones and these holidays within our faith tradition. So inshallah, we hope that everybody who is able to will continue to, at least participate in as many Eid traditions as possible, abiding by social distancing guidelines and some of the information that you've shared, inshallah, so that we can do this safely, knowing that this is, inshallah, temporary, and it's worth it to take these precautionary measures just to protect ourselves. Our final question is to you on a lighter note. This is all, pretty heavy stuff. On a lighter note, how are you and your family planning to celebrate the Eid holiday, inshallah, this weekend?
So everything we talked about in preparing at home for Eid prayer and the deliciousness of food that is prepared, eating something before it's prayer time, strongly contemplating praying at home this time around, and connecting with family members and friends over the phone or through Zoom or Skype or something like that. So we still maintain that. We may not be able to give physical gifts or monetary gifts, but then we have all these online platforms to deliver gift cards and things like that. So we have an opportunity to do those things as well, and making sure that we feast well as well. I'm a foodie, so I will admit to that fully.
Have you planned a menu yet?
So certain traditions always continue, and my ancestry is South Asian, so
Biryani.
so we have sheer korma and we have chapli kebabs and all that deliciousness that goes in the morning, and then of course you have to continue eating throughout the day. It's a festival after all.
That sounds like a fantastic menu. Jazakallah khair. Thank you so much for sharing your expertise and the work that you do in your private capacity through the community and also at the CDC specifically. And thank you for sharing these insights. And we wish you a very blessed Eid to you and your family. May Allah make it filled with happiness and peace and joy, inshallah.
Eid Mubarak.
I mean, Eid Mubarak, Doctor. Thank you so much for joining us. Really appreciate it. And again, just a disclaimer, Dr. Vaid was with us in his personal capacity. Everything that he shared, his own opinions, perspectives, not speaking on behalf of the CDC or any other government agency. So with that, thank you again, Dr. Vaid, and to all the viewers, thank you for joining us in today's episode of the Daily Dose COVID Conversations with Care. We air Monday through Friday at 3:00 p.m. Eastern Daylight Time. Inshallah, we hope to see you tomorrow. And as always, we encourage you email us at info@care.com, info@cair.com if you have suggestions for topics you want us to address on this program, and we'd be happy to do so, inshallah. Thank you so much. Stay safe and Eid Mubarak. Assalamu alaikum.
Assalamu
Assalamu alaikum, everyone.